Welcome everyone to this evening, our session hosted by the National Network of Healthcare Hygienists, and my name is Colette Murray. I'm the growth director here. Before I get to introducing Fran, I would like to just let you guys know a little bit about the National Network of Healthcare Hygienists if you're not familiar. We are a nonprofit organization providing certificate level education for licensed or certified hygienists. We offer professional membership and certificate programs in oral systemic health, and we support hygienists that are wanting to work in integrated settings and ones that want to educate patients and providers on oral systemic health. We currently have 4 certificate programs available, and there is another that's going to be set to launch later this year. That's going to be Rebecca Clark with the Orofacial Recovery Specialist Certificate Program. So that one's coming down the pipe. Right now we are having a trial of our Oral Systemic Educator. You get several modules of content to view for no cost at all. So you can kind of see the quality of the program and see what you're in for, kind of get you thinking about what you'd like to do. So this is on for a free trial right now. We do have a QR code that'll take you right there. So if you did want to snap a picture of that QR code, go right ahead. And it will take you to this page here so that you can go ahead and get in and see what it's all about. Any questions that you have, always happy to take questions and talk about any of the programs that we have or the membership, anything at all, you can reach out anytime. So thank you so much, Fran, for joining us and offering to do this for us. We're all super excited. Let me go ahead and introduce you and read your bio. So our special guest is speaking on the topic of germ-terrain duality theory tonight. She is the Associate Director of the International Academy of Biological Dentistry and Medicine. She serves on their board as the Hygiene Committee Chair and Certified and Accredited Biological Dental Hygienist. She is a Hygiene Committee member, mentor, and lecturer for the International Academy of Oral Medicine and Toxicology. She's a coach and a trainer of biological dentistry and dental hygiene, and the owner of Integrative Perio Solutions, LLC, and Hygiene Naturally.
Because as hygienists, we are healthcare providers. We're not just there removing calculus and stain from patients' teeth. We are actually providing a service that is going to be part and parcel, part of their whole systemic health. Because I don't know about you guys, but I've never had a patient take their mouth and drop it off and say, I'll be back at 5 o'clock to pick it up. The mouth is part of the body. There is no such thing as an oral systemic link. The mouth is not linked to the body. It is part of the body. So that's how we need to treat it. So when we are looking at whether it be germ theory, which we're trained, or terrain theory, which we're not trained, I'd like to combine the two, germ terrain theory, because that way you're going to be able to have a more successful outcomes with your treatment and your therapy that you do for your patients. So basically, I'm asking you to reframe how you look at dental hygiene. I want you to have a paradigm shift in your thought process. The next time you see a patient tomorrow morning, when you see a patient who has a 5 millimeter pocket or has any kind of bleeding, we automatically think they're not brushing, they're not flossing. It's got to be, they have pathogenic biofilm, and let's nuke everything, and that's going to get them healthy. And that's where our brain goes. And I'm going to ask you to slow down and start looking at other reasons why that patient can present with systemic or clinical disease, because it's more to it than just a pathogenic biofilm. How many times we've had patients where we normally, those who have been in a practice for several years, we had our routine patients we'd see every 6 months, every 4 months, or, whatever their schedule is. And they've been quote unquote healthy. The tissue looked great. It's pink, it's stippled, it's peaked. And it's just a beautiful thing. What you like to see, it's an easy prophy, and it's wonderful. But then that same patient can come back maybe a visit or 2 later, and now all of a sudden that same patient has gingival inflammation and bleeding. Now, obviously this is not the same patient, but for conceptual reasons, I selected different pictures. But you can have that considered healthy patient now all of a sudden shift from health to now disease. And our immediate thinking is like, okay, they have a mouthful of bugs and or a mouthful of calculus, and then we just have to get in there, do some SRP or do a BRT, bacterial reduction therapy, or let's do a laser pocket disinfection on this patient. We're just automatically, again, nuking bugs. And that's it. That's all we are looking at. Now, what if this patient now all of a sudden turns into this advanced perio patient who has severe perio disease, but not that long ago, that patient was manageable. And then you're seeing this patient every 6 months, and this patient is not responding to your therapy. So now you're backing them up to every 4 months or even every 3 months. And regardless of no matter what you do, this patient turns into a significant perio patient. Now, as practitioners, our first thought, and again, this is human nature, our first thought is, okay, yeah, this patient's flossing. Yeah, I believe them. Sure they are. Yeah, and I'm the Queen of England. Or they're, yeah, this patient's got to be using the wrong end of the toothbrush and hasn't seen a toothbrush since like the last millennium. But in actuality, it could be more to it than that. Maybe they are modulating the biofilm correctly at home, but systemically, the body or the terrain of the body, the milieu of the body is dysbiotic. It is out of balance. And that is why you see clinical disease in the mouth. So it's more to it than just pathogens. So when we talk about germ theory, we're basically talking about what we consider pathogenic bacteria, right? We're talking about Morphomonas gingivalis, Agrobacter actinomycetum comitans. We're talking about Treponema denticola. Your 5 keystone pathogens, your Povitella intermedia, your Fusobacterium nucleatum. Take your pick. All right, we know of all these bad bugs that can cross the blood-brain barrier and are contributory to Alzheimer's and dementia. They're contributory to cardiovascular disease. And actually, I just gave a lecture the other night, last Wednesday, on nitric oxide and how that's important, that your patients who are deficient in nitric oxide have severe perio sometimes or significant perio. And these patients also have high blood pressure. And we think it's due to the perio. No, it's because they have lack of nitric oxide that is being destroyed, the pathogenic bacteria, reducing the good bacteria. So that's another lecture another day. So there's so many pieces of the puzzle that we're missing that we're not paying attention to. So when we say germ theory, we're thinking about salivary testing and using things like phase contrast microscopy. This is a patient, any of these slides that I'm showing you are patients these are my slides on my actual patient. So when I see bugs like this, spirochetes and probably F. nucleatum, this patient is having an immune response, and that's why I see these white blood cells. So I see bugs. I need to nuke the bugs. I'm going to throw the book at them. I'm going to, in a conventional world, I'm going to use the chlorhexidine gluconate. I'm going to use the laser, etc. I'm going to put them on antibiotics and, put them on whole kinds of systemic antibiotics. And if I'm doing salivary testing, I'm going to use the recommended antibiotics that the salivary testing is going to tell me. But what if you have a patient that also has parasites? This is a trichomonad. And then if you look on the upper portion over here, this is also an amoeba. This is Entamoeba gingivalis, which is also shown to be causal of periodontal disease because this will actually impregnate itself into the epithelial lining of the clavicular space and allow these bugs to get into the bloodstream. And talk about red blood cells, bloodstream, these are anemic red blood cells. They're less oxygenated. And you can see this amoeba they're very mobile. And I have anemic red blood cells, and I have all these white blood cells, which telling me these pathogens are initiating the immune system. But why is there such a hot mess here? Could it be that the terrain of the body is also a hot mess? Could it be that the patient presented with systemic issues that is weakening their immune system? And that is why they are showing more clinical signs of disease than somebody else. Now tell me, I bet you almost every one of you are going to raise your hand when I ask you this question. How many have you seen patients that have not seen a toothbrush since their first birthday, calculus galore, full mouthful of plaque and biofilm, but show no clinical sign of disease. Tissue is not bleeding or negligible bleeding, no problem. And then you also, in the same vein, you have a patient that brushes, flosses, rinses, water picks, uses everything under the sun, can open a drugstore with all the paraphernalia they have. They're doing so much home care, but regardless, their tissue is still friable, bleeding, inflammation, no matter what they do. Patients like this has a lot to do with the terrain of their body, has a lot to do with what's going on systemically just with their body, because there are medical issues, whether it be immune system issues, or we're going to talk about shortly, there are four pillars of health, according to Paracelsus. So when we're reviewing our patient's medical history, how thorough are we? Now, here we have our one size fits all medical history. Basically, do you have asthma, diabetes, arthritis? When was your last hospitalization? When I was working in a conventional practice, I basically would say to patients, my standard question was, are you on any new medication since your last visit? And have you had any hospitalizations? And then I would just document their response. And then, if they said they were on a ACE inhibitor or a beta blocker, I'd say I knew that there was a patient had cardiovascular disease, and I'd make a mental note of that, and while I'm looking at the oral cavity, but that's about the extent of it. But as a biological practitioner, I want to do more of a deeper dive on my patient's medical history. The reason being is because I know that there's a duality. What's going on in the mouth can affect the systemic portion of the body, and then systemically things can be going on that will affect the mouth. Paracelsus is the father of modern toxicology. And actually there is, for those of you who have taken the OSCE, excuse me, I've talked about it in that module, where there is a place in Switzerland called Paracelsus, where it has a medical facility and a dental. And the medical facility, people who are very, very sick tend to go there, who have, God forbid, cancer, multiple sclerosis, diabetes, any kind of significant disease that they can't seem to get a handle on with conventional therapy, they will go there. And the medical will not touch that patient unless they've gone through the dental first, because there are a lot of focal infections or other barriers to health that can happen in the mouth. So that's why they work in tandem together. So the whole paradigm of Paracelsus, four pillars of health, when we're talking about terrain theory, which we're going to talk about who started the whole thing with terrain theory in just a little bit, but there are four pillars that we need to pay attention to. Elimination and detoxification. And I'm going to be blunt. Is your patient pooping correctly? Is your patient using the restroom correctly? Or what color is their urine? Of course, you're not going to ask this type of question, but you can ask, how are your bathroom habits like? Is, when you go number one, is it what color? Is it a good color? Or is it dark, too dark? Are you using the restroom regularly, number two, on a daily basis? I go once a week. Once a week, the body is full of toxins. That's our body's way of eliminating toxins through fecal matter, through urination, through sweating. Okay, so if a patient cannot properly sweat, because some patients have that issue, or any kind of elimination issues, that patient can be full of toxins, which can throw off the body. Okay, that can be out of homeostasis. Restoration of the microbiome and nutrition. Now, when we're taught in school about nutrition, we're basically taught about sugar and carbohydrates cause decay. We're not taught about the fact that we can have patients that are micronutrient deficient. They could be micronutrient deficient because of poor diet, going to Mickey D's or Chick-fil-A or Burger King, and take your pick of any of these, Taco Bell. Any of these types of foods, patients can be micronutrient deficient, or there's other reasons why they're micronutrient deficient is they have malabsorption issues, gut issues. They can have MTHFR, which is a genetic mutation where they're not going to be able to assimilate things. That being said, we need to make sure the microbiome of the body is healthy. Also, rebalancing of the regulatory system and cell regeneration. What if my patient is full of oxidative stress? Oxidative stress has many reasons why a patient can be under oxidative stress. Oxidative stress is when the body has an abundance of free radicals. I'm smoking, I'm drinking a 6-pack a day. I'm out all night partying and going out with my homies, and going to clubs. That was my old maid, by the way. Wink, wink. That was back in the day. No, not, I'm joking, not really. But, people who live a lifestyle like that,
I'm
they're
so
not
I'm
their
on
sleep
headphones.
hygiene.
What?
Can you mute? Thank you, darling. Um, the the sleep hygiene is really important because, if you're getting 3-4 hours of interrupted sleep, you're not fully rested. So all these things can actually cause um, oxidative stress in the body. So what's going to happen is the patient's not going to heal that well. So these are things that we really need to pay attention to. And also resetting of the autonomic nervous system. Your patients, I'd say a large portion of us are stuck in the sympathetic mode, meaning fight or flight. Oh, I stay on time with my patient. Oh, I got to hurry up and get home because my daughter has to go to piano lessons. Oh, I got to hurry up and make dinner because at 7 o'clock we have to go to the soccer game. Or, my boss is driving me crazy. He wants me to do all these patients. And, my husband, I'm ready to bury him in the backyard because he just won't leave me alone. When he sees them, I'm stressed out. So all these things can create our nervous system to be out of whack. So all these things can cause the terrain or the milieu of the body to be out of balance. And the whole concept of biological medicine, biological is the body, right? Biological medicine is the body wants to be in a state of health. It wants to be able to self-regulate, and it cannot self-regulate when there's things going on like nutrient loss, conditions causing increased nutrient needs, if patients have viral bacterial infections, if patients have immune system activations or immune system disorders, they can't detox their body, meaning they have problems with bowel movements and urine elimination, right? Or if it's too strong, not enough water. So when I'm asking my patient about their medical history, it needs to be more informed. Like, this is your patient, that your general, everyday healthy patient. But what if my patient has a more convoluted medical history? I'm going to ask more questions. Things like, what is their dietary input like? Are they able to assimilate their food and get the nutrients out of it? What are they have impaired uh, digestive system. Okay, there's lots of questions I need to know the answers to. All right, do they have any type of intolerances? When I say intolerances, it's not necessarily an allergy. It could be a reactivity. If a patient has a reactivity to a certain um, metal or certain food or a certain chemical or whatever, that can cause a cytokine storm in the body, can cause an inflammatory response, which is going to cause the body to be out of balance. So things that we don't even look at on a regular basis can be causing your patient's periodontal condition to be worse than it would normally be, or patients are presenting with issues that cannot be resolved with all your hard work. And that's why I wanted to talk to you about this, because a lot of times, like I said, we'll blame our patients. They're telling me they're flossing every day. I don't buy it. They could very well be, but their body is not physically able to respond to all your amazing treatment because it's dysbiotic. It's out of balance. And this is why we need to really pay attention and ask these questions of our patients and really look at their medical histories. All right, looking at their dental history, do they have any reactions to metals or acrylics? All right, is there any chronic issues that they have going on that they need to see, that you need to really look at? I love this graphic. And Karen, I know you do too. Because a lot of times we will look at something, we'll look at the symptom and want to treat the symptom. To give you an example, Alzheimer's is a symptom, cancer is a symptom, arthritis is a symptom. You can put periodontal disease here as a symptom. You can put dental decay here as a symptom. Because there are more factors that go into periodontal disease, gingivitis, etc., and tooth decay than just strep mutans and sugar and bugs and not brushing. Okay, these are symptoms that we are treating. There's got to be a core dysfunction. There has got to be a root cause why my patient is presenting with periodontal issues that are not resolving. Or you do the SRP on that patient and they come back in 6 weeks and they're still bleeding. It's better, but it's not resolved. All right. And then you see that patient of several visits later, and now we're almost back to square one. Because did we really address the full picture? I'm not so sure. And I'm going to show you an example of what I mean by this. This is my ankle. This is me back in 2017. I was helping a friend of mine. I was temping for him on a Saturday. He asked me to help him out. Sure, no problem. I wanted a quick run out to my car to grab a quick lunch in between patients, and it was raining outside. I slipped on the stairs and my leg stayed on the top stair and the rest of me went down the rest of the staircase, and oh my God, yeah, I saw stars and stripes and the whole, yeah. I hobbled my way back into the office, quite immediately swelled up. Didn't think much of it. I had to finish the day. I'm sorry, I'm a Generation Jones. Put a Band-Aid on it and I'll be fine. I finished the rest of the day. Got home. I don't know how the heck I drove home because this was my right ankle. Got home. My husband took one look at it. I'm bringing you to the ER, which we did. And sure enough, had a non-displaced fracture of the right tibia. They put a boot on it and they said, we need you to see your orthopedist and just go from there, which I did. Went to the orthopedist and he agreed. He put a different boot on and he said, look, I want to see you in 4 weeks. Want to take an x-ray, check the healing and see how you go. I said, no problem. I do. I see him in 4 weeks, takes an x-ray. It's healing beautifully. We can leave it at that. If you don't want to wear the boot all the time, you don't have to. Well, you didn't have to ask me 2 times. You know, I wasn't wearing it all the time. I did wear it, when I had to do a lot of walking around, but for the most part, in the house, I wasn't wearing it. So time went on. I remember being away with my family, and gradually over a couple of weeks, the pain in my ankle started to worsen and worsen and worsen. And I'm away with my family, and I was in the car on the way home crying, literally crying. And I'm a tough broad. I'm from Jersey, so nothing bothers me. So I was crying in the car. So I call my rheumatologist. I do have RA. Call my rheumatologist thinking I had an exacerbation of my rheumatoid arthritis. Gives me Midroll dose pack, and he goes, but I do want to see you tomorrow. So I go in, and he walks into the room. I'm still crying, and he does an exam. He goes, Fran, I'm looking at all your joints, and it's unilateral. I'm not seeing bilateral inflammation or pain. I want an x-ray of that ankle. Go in, they take an x-ray of my right ankle. The tech comes running around the corner and he goes, you broke your ankle. I said, yeah, 2 months ago. He goes, no, it looks like you just broke it today. I said, what? He goes, it looks like you broke it today. So my rheumatologist said, I want you to see a surgeon. It looks like you have a non-displaced fracture. I'm like, wow. I mean, a non-healing fracture. I was like, what? Go to the surgeon. He wanted to put plates, screws, and pins in my ankle. And I said, we're going to hold on that. I'm going to Cancun tomorrow to lecture. When I get back, I will revisit this. As I leave his office, I call my friend, my naturopath, and I said, I need you to take a look at something. When I get back from Cancun, I went to my naturopath and I said, look, this is the issue. It was healing. My doctor said it was healing. Now it says it's not healing. He's like, I want to see your blood work. takes a look at my blood work. My calcium was at 10.8, which is at the high end of normal. In the conventional world, is the very high end of normal, or just 0.1 point over normal. He goes, I want your parathyroid hormone checked. And I'm like, okay. So we'd go and do that. My parathyroid hormone was high. My calcium was high. What does that mean? Parathyroid hormone regulates calcitonin, which is, your blood calcium level. So if you have low calcium, your parathyroid hormone should be high. If your calcium is high, your parathyroid hormone should be very low because you don't need it, right? So if both of them are high, what is that telling you? Something is going wrong with the parathyroid. Sure enough, I had 2 adenomas on my parathyroid glands. So what they did is sorry, that's a beautiful shot, isn't it? Right up my nose. They removed, this is the day of surgery. They went in, removed 2 parathyroids, which they checked, and my parathyroid hormone went down immediately as soon as they removed them. Now you tell me, did I need screws, pins, and plates in my ankle? No, I did not. Why? Because I was able to get my body to self-regulate, because I knew there was something wrong, because it was healing, not healing. And I was able to get my body back into quasi homeostasis, because we can't really be in homeostasis just living in the United States because of the tainted air, water, food, and everything. So I was able to get myself regulated, and my body was able to bridge and heal it. That being said, I'm telling you the stories because I want you to take that story to understand. When you see clinical disease, there could be actually something else going on, that the body, the milieu of the body is out of whack. And that is why maybe you need to send that patient to a PCP, or if they have an integrative doctor, or a functional doctor, or a naturopath, or just their PCP. So I'm concerned, let's do some blood work on you, just make sure that everything is okay. But again, this is a patient that you know and you understand, and of course with your blessing of your dentist, your doctor. Because when we are ignoring the terrain of the body, we're not treating that patient as a whole. So when it comes down to germ theory, it is the germ theory by Pasteur. It is about the microorganisms are the primary causal agents of disease. Terrain theory is that microorganisms become pathogenic as the health of the host organism deteriorates. Hence, the condition of the host organism is a primary causal agent. Now, hear me out. It's Father's Day this coming weekend, right? Those of you who may be having family and friends over, a house full of people. And then you have one cousin, Susie, who is coming to the party, but she's sick as a dog. She's snorting, snotting, sneezing, and coughing, and sick as a dog. But she wants to come because she can't wait to get your meatballs and your ziti. All right, she's coming no matter what. So cousin Susie shows up, sick, coughing, etc., and she now exposes everybody at the party to her germs, whether it be viral or bacterial. Now, you tell me, is everybody in that party going to get sick just like Susie? No. Why? I'll answer for you. Their immune system. Some people's immune system is robust and they won't even get a snivel. Others will get a little bit of a snivel and then they're better in like a day or two. It's really not that bad. And then others will get sick just like Susie, and then one, maybe two, God forbid, almost wind up in the hospital or wind up in the hospital. Why? They're different. They're all exposed to the same pathogen, but they responded differently. Why? Because the terrain of the body is different. And this is how I want you to look at your patients. So it's not just I see a bug, I got to nuke the bug. Is the body healthy enough to fight off that bug? Or is it that, the patient's body is not healthy, is why they are reacting to the bug? And that's where you have the terrain duality theory, where you are looking at the two causal agents of disease. You're looking at both the germ and the terrain, and they are both equally significant. I am a big terrain theory person, but I also do believe in germ terrain duality theory because, you know, some bugs we know just or will, cross the blood-brain barrier and, cause issues, whether the patient's healthy or not. So, but I want you to really pay attention to this and see if this is going to resonate with any of the patients that you may have had recently. So this is a brief video I want you to hear
You may have heard of germ theory. This
what
is
the
a
difference is.
scientific theory currently accepted in mainstream medical thought that microorganisms such as bacteria and viruses cause human and animal disease. These microorganisms can cause so much trouble in our bodies, creating pains, discharge, nausea, and more. They could totally destroy our bodies if we were to allow them. But fortunately, we have our immune systems, medications, herbs, and can support our terrain from becoming susceptible to infectious agents. The terrain consists of the entire human organism. It includes the health and vitality of the immune system, which attacks and monitors invading organisms. It includes the integrity of tissue, such as the skin, which acts as a barrier to invading organisms. It also includes the health of our organ systems and how much inflammation may be present, which makes those tissues vulnerable to attack. Terrain theory and germ theory work well together. Terrain theory takes into consideration the vitality of the body in which the organism is attempting to invade. The internal ecosystem of the host plays a vital role in how a person responds to a bacteria or virus. When our immune system is sharp and on patrol, it will attack invading organisms, preventing illness. The immune system creates memory cells, which then allow it to respond sooner when it meets the same microorganism. If the body is already under stress from chronic inflammation or excess stress, then it cannot respond as strongly or effectively to invading organisms. The stress hormone cortisol acts like a blanket over the entire immune system, suppressing it. This may explain why some people get sick after traveling or after long bouts of stress. Some bacteria can easily overcome our defenses, while others are effectively held at bay. Adding terrain theory to germ theory doesn't refute or change germ theory in any way. It gives us the opportunity to be proactive in our life and health. When we eat nutritious food, exercise, and get plenty of sleep, our body is kept in tune, preventing viruses and bacteria from getting a foothold, causing sickness. We can work with both terrain and germ theories to support our bodies, practicing basic hygiene to prevent illness.
So even though that's talking about, physical illness like a cold, but it still also pertains to periodontal disease or oral conditions for sure. Because the healthier the body is, the better the patient's going to respond to the treatment that you deliver. Because just focusing on one piece of the puzzle and not addressing everything else, your patients will get partial response, not full response to your treatment. And this is where sometimes you have to repeat all the SRP. And in actuality, it's the terrain of the body or the physical portion of the body that needs to be addressed. So when we talk about biological dentistry, and I'm not here to convert you to biological dentistry, but biological means body. So any of us who are healthcare providers that are interested in oral systemic link, we really are sort of a biological practitioner, right? Because we're not just focusing on the mouth. All right. And there's a lot of barriers to health because of dental issues. And dental situations are viewed in the context of a person's total toxic burden. And those are the things that we reviewed earlier. Not sleeping, not eating right, they're drinking, they're eating garbage, garbage in, garbage out, right? Eating garbage food, being stressed out, oxidative stress, all these things can affect the terrain of the body. So they're not going to respond to the treatment that you're delivering. Okay. It disrupts the body's self-regulating abilities. And if we are not paying attention to the terrain of the body, we're just going to have improvement by pure luck. All right. And that the terrain, as they say, is everything, and nurturing its health is key to biological medicine and dentistry. And basically, the terrain is disordered and polluted, that dental burdens can do the greatest damage to a person's health, which means that if the terrain is out of balance, any infections or dental burdens in the mouth are going to be exacerbated and cause more damage than if the pathogens were there by themselves and the body was healthy. So these are things that need to be looked at. So that's why I'm asking you to reframe the way you see your patients from now on. As I mentioned earlier, in 1986 is when they said that the studies are showing that the immune response to the bugs, and it's not the bugs themselves, is what's causing periodontal disease. So basically, the etiology of perio, you need two criteria for disease to happen. First, you need to have the pathogenic microflora. And what is your second criterion? We just said it. Your susceptible host. Your susceptible host is your patient who has all these issues that we just talked about, has a compromised medical history, has a compromised lifestyle, for whatever reason that may be. Okay. And that's where you're going to initiate the immune response. So what happens is the pathogenic will initiate inflammation, causing that immune response, which will initiate connective tissue and bone loss, connective tissue loss and bone loss. So it's more to it than just germs. So here we have Louis Pasteur, who is the father of the germ theory, and then Antoine Béchu. I'm not sure if I'm actually saying his name correctly, Béchamp. We're just going to say it the English way, Béchamp, okay? But I'm not really a French speaker. But the history awarded the renowned reductionist Pasteur with being the father of immunology. Basically, the vaccines and antibiotics kind of was born out of Louis Pasteur's, findings, and not just Pasteur, but also Koch's postulates. So what happens is it's he found that it's the microorganisms and that are causing disease, and actually Koch has the 4 postulates, and that you have to meet the criterion for these 4 postulates for it to actually be causing disease. And at the very same time, Antoine Béchamp basically saying, phooey, it's not the germs, it's the terrain of the body. All right. He said it's the mini ecosystems within the body that is causing the body to react to the pathogens. And it's not the pathogens, because the healthy body is not going to show any kind of response or symptom to the pathogen, because the body can fight it off. So there was a battle between the two of them, but it turns out that Pasteur won out of that battle. And that's where it was born out of, where we have vaccines and antibiotics and all that. So not against it, but for sure, but we have kind of neglected the findings of Dr. Béchamp, because we can't forget that we have the body is here and the mouth is, we have to look at both, in my opinion, for whatever that's worth. And it just makes sense. And here's Koch's postulates. Those of you may be aware of it or not. I don't want to be here and train you on it, because it's just part of how they learned about germ theory. But again, it's a lot of things that we need to pay attention to both. So the primary cause of disease is within us, always within us. That's Dr. Béchamp. And Hippocrates even said, it is more important to know what sort of person has a disease than to know what sort of disease a person has. Because if their immune system is robust enough, they could potentially fight off the germs or have less systemic or symptoms to those pathogens. The body's natural forces are within us and are the true healers of disease. Again, Hippocrates. So, introduction to some of these disease theories. So, the germ theory and terrain theory are key frameworks explaining disease origins and guiding health and maintenance strategies. To put it simply, you have fish in dirty water or fish in clean water. Germ theory, you vaccinate the fish. Terrain theory, you keep the tank clean. That's as simple as we can get it. So if you protect the fish, it doesn't matter, you know, give them antibiotics, give them vaccines, even if there's pathogens around them, they're not going to get sick. But if you keep the fish healthy by having a clean environment, then that patient or that fish won't get sick. The core principles of germ theory is established by Pasteur and Koch, and they demonstrated that microorganisms cause disease and developed methods to identify the pathogens. All right. Disease results from bacteria, viruses, fungi, and parasites. And if those of you who don't know what ozone is, or medical grade ozone, I'm going to highly recommend that you look into it. I do give courses on medical grade ozone and how it's effective and how it boosts the immune system without affecting the healthy microbiome. And any collateral damage that it does harm, it immediately replenishes because the healthy bacteria replicate very, very quickly. We are not causing antibiotic-resistant strains of pathogens. Medical efforts concentrate on identifying and eliminating pathogens by using vaccines and antibiotics and sterile techniques, which is important. Absolutely. We have to keep everything sterile and clean, and, you know, we need antibiotics and certain vaccines for sure. But again, we also need to pay attention to the body. It was proposed by Dr. Bichat, and the internal environment over the external pathogens. And it's basically the disease arises from the internal imbalances, focusing on strengthening the health of the body. Kind of like my ankle wasn't healing. I could have put screws and plates in it. Or do I find out what's causing why my body's not healing? Something's wrong in my body. We removed the offending parathyroid glands, and my body was able to heal. Okay, so germ theory attributes disease to pathogens, while the terrain theory focuses on internal body imbalances. But doesn't it sound like they can work well together? Absolutely. Treatment approaches. Germ theory, we're using an antibiotic, right? Or some type of drug. The terrain theory promotes a strengthening of the body's internal environment. And how do we strengthen the body's internal environment? By living better, proper eating, drinking, sleep, eliminations, all those 4 pillars of health, micronutrient absorption. Okay, we want to have a lifestyle that is going to be beneficial. And we're at this point, with the amount of antibiotics that we're getting prescribing, and then even in the dental world, we're prescribing more antibiotics now because we're getting our salivary testings back, and we're putting our patients on antibiotics. Now there is a strain or a variant of Porphyromonas gingivalis that is antibiotic resistant. So we're even creating superbugs of our pathogenic, periodontal pathogenic bacterium. And if they're saying that if we keep going down this route, that we will have resistant pathogens will become a bigger killer than cancer by 2050. So we have to find other ways of managing disease and symptoms. Okay, so Pasteur, Weiss dominance, he established the germ theory. And then Bichat overshadowed the validity of germ theory. He said, no, it's the body that you have to emphasize. And they just fought it out. It was a rivalry. And it happened all through the 19th century. And it looks like Pasteur won out. But I'm going to ask you to try to incorporate both. Because you want your patients to heal. The best way is to have a clean slate, have a healthy system to be able to address the disease, the clinical disease you see in the mouth, whether it be rampant decay or periodontal disease. Okay, you want to emphasize the body's health. That's why working with the PCP integrative physician, functional medicine, naturopath. Gut microbiome is huge, huge. That's your immune system right there. And plus, you're swallowing over 1 billion types of bacteria. And plus, it's one long tube. It starts here and it ends back there. One long tube. So any of dysbiosis in the mouth is going to affect the gut. What's going on in the gut is going to affect the mouth. It's going to affect the systemically. So we have to make sure that gut microbiome is in a state of health. No leaky gut, leaky gums. Right, Karen? So germ theory and infection control. So we have to keep things clean. So working in tandem, the two is going to help your patients get healthy. So germ theory will focus on the pathogens as a disease, while the terrain theory emphasizes body's internal environment and disease susceptibility. So the next time you see a patient who has periodontal disease, I want you to start to ask yourself, I wonder which pillar this patient's under. Is they have a lot of oxidative stress? They can't eliminate, well, what's going on that's causing their body to be dysbiotic and why they show clinical signs of disease, and how can I help them? Other than just doing SRP and showing them how to modulate, which you need to do, I'm not here to tell you that you don't need to do what we have to do. Nobody loved a good SRP better more than me. Oh, yeah. And I was trained when you had to denude the root. You had to scale until it was a glass-like surface. Could you imagine how many patients I harmed in those years? That being said, you need to do that, but we're forgetting about that different second piece of that puzzle. It's crucial to be able to have long-term success in the treatment that you've done. Integrating approaches for the health advancement, combining pathogen control with strengthening the body's terrain fosters a holistic health, and not even holistic, it's just health. And if you want to spell holistic with a W-H-O, holistic, okay? As far as I'm concerned, holistic health should be natural standard of care health, because we should be looking at the whole person, not just the teeth between the nose and the chin. We're going to be able to improve disease prevention and recovery. And a couple other things I just want to quick go over that can actually also contribute to dysbiosis of the body is patients can have metal allergies and metal reactivities. Patients who have partials or PFM crowns, they can actually, that could be exacerbating or be a causal factor of your patient's periodontal issues. I have a whole nother course on these types of things, and I'm just putting one study here that metal allergy can actually cause periodontal issues and lichen planus. How about your patients with dental amalgams? There's a level of mercurialism. So some patients cannot properly eliminate mercury from their body. They're called hoarders or non-excretors. So a non-excretor, meaning that any of the mercury that's gassing off these mercury fillings is causing the mercury, their serum, their plasma mercury level and their urine mercury level to be very high. And actually, your non-excretors, you're not going to measure any mercury in their urine or even in their hair test. All right. And what'll happen is these patients will have areas of periodontal disease, especially around the teeth that have these mercury amalgam fillings. They're reacting to the mercury. One of the symptoms of mercurialism is that your teeth fall out of your head, causes periodontal disease, causes severe perio issues. So these are things that I'm asking you to look at because it's more than just the bugs. And then, as we already said, oxidative stress. Oxidative stress and periodontal disease. There are a multitude of studies that show how that is correlated. Oxidative stress is caused by, improper sleep, not eating right, stressors with family, work, etc. And what happens is the body's under constant attack from oxidative stress because what happens is you have an abundance of free radicals that are running around in the body. And we need antioxidants in the body because the cells of your body will actually create its own antioxidants. But if we're overwhelming it with a poor lifestyle or medications we're taking that's causing these oxidative stress, there's going to be more free radicals than our body can produce antioxidants to fight. And then you'll get cell damage. All right. Periodontitis is an inflammatory disease of oxidative stress. There's something else called a root cause protocol where the body does not know how to properly, or the cell is not properly using iron, copper, and magnesium. So on a cellular level, we need to look at our patients, not just what we see clinically, how much calculus they have and what their pockets, they have a 5, okay, now it's a perio patient. I've treated patients with 3 millimeters, but they were bleeding, and my slides showed they had amoeba and spirochetes. So what am I going to do? Wait for them to have a 5 millimeter pocket, or am I going to treat them before they have disease? I'm going to treat them before they have disease, because I got to get that patient healthy before they exacerbate. I had ovarian cancer back in 2019. If my gynecological oncologist said to me, "Oh, your 4.5-pound tumor is not big enough, and your CA-125, which is supposed to be 30, but is now 116, is not high enough, so we're going to just watch it until it gets worse," I'd be running to the AMA and filing a suit against that doctor, and I'd find somebody else. But we're doing that with our patients. It's not a 5 millimeter pocket. I can't see radiographic calculus, and I don't see any radiographic bone loss. So they're not a perio patient, so I'm not going to treat them. I'm just going to see them every 6 months. But something's going on in the train of their body. Something's going on in their health, and they're overreacting to the pathogens that are there. So what happens is, if we have a way of treating our patients who are in oxidative stress, they're going to have better outcomes from the perio treatment that we're delivering, if this is part and parcel what is causing their disease. Okay. Environmental and nutritional factors appear to be useful in evaluating the risk for periodontitis. Last thing I'm going to mention is vitamin D. How many of your patients, how many of us are vitamin D deficient? We live in a world where we live on these things. These are the runation. You're going to have to drag it out of my cold, dead hands. We live on these things. They're computers that happen to make phone calls. We're never outside anymore. So that part and parcel is why a lot of us are vitamin D deficient. Plus, we're not able to assimilate the vitamins of the foods that we eat. A lot of our foods are nutrient deficient because our soil is depleted and it's been filled with glyphosate and not a proper nutrients in the soil. So our foods are not even good for us anymore. So we're deficient in a lot of micronutrients. And there are a multitude of micronutrients that you need for health and for periodontal health. But vitamin D in particular, not just for perio, but also for tooth decay. In this particular study, it's showing that vitamin D is significant in periodontology, and you really need it as part of synthesis of proteins that are needed for formation of mucous membranes that will stop the invasion of the pathogens into the epithelium. Okay, vitamin D also takes part in specific immune response. What did we just talk about? Immune system. By suppressing the destructive effect of chronic periodontitis. This is only one study of many that I have. So at this point, I want to ask you to reevaluate how you are looking at your patients. Just because we see a bug doesn't mean we need to nuke it. When I say bug, of course, I mean an oral pathogen. Just because a patient is not showing signs of resolving their periodontal condition does not mean that they're not brushing and flossing. It could very well mean that we're not looking at the terrain. We're missing the piece of the puzzle that is not giving us the answer. We need to take a look beyond the mouth. And that's why, as with NNHH, the network of healthcare providers, we as holistic hygienists, we need to look at the whole body. The oral systemic link, even though I don't like that word, but we need to look at the whole body. And that's why this quick little lecture on terrain germ theory I felt was important, because now you'll be able to go in the office tomorrow morning and have a different set of eyes to be able to help you treat your patients. Now, if you ever have any more questions about things that I talked about today, I do also lectures for I do them maybe once a month for a school here in New Jersey on things like ozone and fluoride alternatives and evidence-based periodontal therapy and all these other things that I do. And I'm also part of the IABDM, International Academy of Biological Dentistry and Medicine. If you have more questions about what biological dentistry is, what the heck is it? Well, then you need to take the oral systemic education course through NNH. But if you want to go a deeper dive, then you can also reach out to me at the IABDM. And if anybody ever wants to have any kind of office training, I'm more than happy to help you out there. I'm not trying to here to sell myself. I'm just trying to live my blessed life. When I say I'm living my blessed life, because at this point in my life, after I had my bout of cancer in 2019, I felt that I was put in a place where I was able to beat it and get to this point for a purpose. And my purpose is if I help one practitioner look at their patient with a different set of eyes to be able to help them at another level that they didn't think was possible, then I'm here for and I'm fulfilling my purpose. This feeds my soul. So I'm here to help you help your patients, because that even though I'm not touching a patient anymore, but if I touched you in any way that you touch your patient, by default, I feel I have spread the wealth and have helped others. I am giving a 2-day workshop at the end of October here in New Jersey on how to practice biological dentistry. If you're ever interested, you can reach out to me about that. But more importantly, I asked them if they would allow me to do a quick PSA. So I know I'm running late, but I'm going to give you a quick PSA on ovarian cancer facts. Today, I was at my gynecological oncologist, and he gave me a hug and a kiss and said that you are now just past 5 years. Congratulations, you've beat the odds, and the chance of recurrence are much lower. And after I beat it, for the most part, I went and even got a tattoo on my arm so that people would ask me, oh, that's a nice tattoo. I like that, because I want to be able to tell them the symptoms of ovarian cancer, because it is usually fatal and it's found at too late of a stage. And I wanted you as women to know, because even if you're not a woman, you have a mom, you have an aunt, you have a sister, you have a cousin, you have a grandmother. I want you to know the signs and symptoms, because they mimic so many other things. Those are the more you know, the more that you can help. So abdominal swelling and bloating, feeling full after only eating a bite or two of food, a debilitating exhaustion, okay? Changes in bowel and urine habits. So these are all signs that mimic so many other things. You can't test it with a pap smear. There is no test. And the only thing that can potentially detect it is a transvaginal ultrasound. So please know the signs, know the symptoms. And I hope this, even never mind my perio talk, I hope this helps one person. Then again, my life has been fulfilled.